Welcome to Pediatricks. Febrile seizures. Our parents are very much worried when kids get fever, whether this will cause a seizure or a fit in the child. So basically, fever with seizures are seen in three main conditions. One is febrile seizures. Next is encephalitis, the infection of the brain. Third is meningitis, the infection of the layers protecting the brain. So the points against febrile seizures, when the seizures happen without fever, when there is features of brain irritation, like irritability, babies yelling, inconsolable cry, the fontanelles are bulging, the baby is not able to extend or flex the neck, it's holding it very stiff, altered sensorium, baby is not able to recognize the parents' time and not able to do the usual activities. All these things point towards something more serious than just febrile seizure. So we need to rule out other conditions like meningitis and encephalitis when you have these features. So in this presentation, we are trying to talk only about febrile seizures. Febrile seizures are mainly seen in kids from 6 months to 6 years of age. It's quite common, like almost 5% of kids get at least one episode of febrile seizures in lifetime, and most of Indian kids, like almost 10% of Indian kids tend to have febrile seizures at least once. And it's seen slightly more in boys. Fever causing seizures can be due to any illness, like post vaccination, kids tend to get fever. This can cause febrile seizure. Viral fever, just common cold can cause febrile seizure, but this happens in kids who have a tendency to develop febrile seizures, not in all the kids. Usually, the seizures happen within 24 hours of onset of fever. And we don't have enough evidence to say whether it's the rise of temperature or the peak of temperature, what exactly causes the seizure. Febrile seizures can be two types. One is simple seizures, the other one is complex seizures. The most prevalent one is simple seizures, and again, both are seen in kids from 6 months to 6 years of age. The duration is usually less than 15 minutes in simple seizures and more than 15 minutes in complex seizures. Usually in first 24 hours, it happens only once in febrile simple seizures, and it can happen multiple times in complex seizures. Neurodevelopmental abnormalities, delayed milestones, everything is seen more commonly in complex febrile seizures. Generalized body involvement, all the 4 limbs getting involved is seen in simple febrile seizures, and if it's only one limb, it's mostly complex febrile seizure. Most of the time after seizure, the baby may sleep for some time and they wake up normally and they behave normally. And this happens in simple seizures, and in complex febrile seizures, there can be a little bit of weakness, especially on one side of the body after the seizure occurs. So, the risk factors for febrile seizures, like which kids do develop seizures when they have fever. Mostly these kids have a history of a first degree or second degree relative having febrile seizures in their childhood, father, mother, first cousins. And most of the time the parents would have forgotten about this because it had happened in their childhood, like less than 5 years of age. So if you ask the kids' grandparents, they might be able to tell you that the parents had seizures at one point of time, maybe once or twice, and it disappeared completely after 5 years of age. So this is a very common history you get. So you ask your parents whether you had it in childhood, and then there is a risk that your child may get it when the child gets fever. And the other risk factors are the baby staying in NICU for a long time, baby having a developmental delay, delayed milestones, the baby attending play school, daycare. All these kids have a slightly higher risk of developing febrile seizures when compared to other kids. Now the question is, the baby already had a seizure. Is there a risk for recurrence? Usually when the seizure has occurred when the child is less than 1 year of age and very early during the fever episode, and the fever's peak not being very high, all these things are major risk factors for recurrence. And again, family history of febrile seizures, complex febrile seizures, daycare attendance, boy babies, all these are risk factors for recurrence of febrile seizures. Now, the most concerning question is whether this will become an epilepsy or a seizure disorder later on in life. In say simple febrile seizures, the risk of developing epilepsy later on is less than 1%, and recurrent febrile seizures is still less than 5%. In complex febrile seizures, the risk slightly increases. and family history of epilepsy, not family history of febrile seizures, but in family history of epilepsy, the kids developing epilepsy later on increases, especially if the kid has a neurodevelopmental delay associated with history of febrile seizure. In these cases, there is a risk of subsequent epilepsy later on. But as such, just a history of simple febrile seizures, most of the time in the normally developed child, they usually develop no say intelligence problems, school performance, behavioral abnormality, no long-term effects whatsoever, even if there is a history of febrile seizures. Now, you have got a child had febrile seizures, you go to a hospital. Most of the time, you don't need to investigate the child. You get a clear history of fever, family history of seizures, and the child appears absolutely normal after a sleep of small duration. After seizures, the baby wakes up absolutely normal. So in these cases, you get a clear-cut idea it's most probably a febrile seizure. Blood tests may be done to establish the cause of fever. And when you suspect a meningitis or encephalitis, as mentioned earlier, the baby is disoriented, inconsolable cry. In those cases, we may have to do a analysis, CSF analysis, do a lumbar puncture, take the fluid from the spine, and check whether there is any infection. And in that case, you need a totally different treatment. And in very rare cases, like when there is a developmental delay or things like that, neuroimaging, CT or MRI of the kid may be suggested. And even rarely, an EEG may be suggested. EEG is basically recording the electrical activity of the brain, just like you check the electrical activity of the heart by doing an ECG. EEG to check any abnormal electrical signals from the brain may be done in rare instances. Now, the big question, what to do when the child is actively seizing? So, first of all, what you need to do is move the child to a safe place. Like if the child is in a place where it's slightly high, remove the child to the floor. Avoid water bodies nearby. Loosen any tight dresses and ornaments so that the child can breathe properly. And place the child in slightly side-lying position. Otherwise, there is a risk of aspiration. When anyone is unconscious, there is a risk of swallowing one's own secretions and that going into the windpipe. So side-lying position will help to take it out or bring them out by itself. And if there is an active seizure happening, don't try to hold the child and contain it. It won't happen because you cannot stop an active seizure. The seizure is occurring because of an abnormal electrical signal from the brain, and the body is just responding to that signal. So even if you hold the body tight, the child is not going to stop the seizure. And in prolonged cases, the seizure is going on for a long time. If in the hospital, you might be given a nasal midazolam spray or a rectal diazepam to control seizures. And in cases when the kids are recurrently having these kind of seizures, these medicines may be given to the parents to use it by themselves after proper training. Basically, if you see a fever in the child, use antipyretics, paracetamol, brufen to control the fever. And our old, the age-tested treatment is tepid sponging, where you wipe the child with lukewarm water or tap water to bring down the temperature. And one thing in tepid sponging is just keeping a wet cloth on the forehead is not going to help in any manner. That is an image created by the movies we watch. That is for the sake of keeping the camera to focus in that particular area. But otherwise, what you need to do is the axilla and groins are the areas where there is maximum blood supply. You need to wipe that area with tap water, and then don't keep that water on the body itself. Just mop it dry with a dry cloth. Otherwise, for evaporation of that water, heat is absorbed from the body of the child and the child starts shivering. There are controversies now whether it is tepid sponging is beneficial in bringing down temperature, but some people still advocate it, some people are against it, but there is no harm in trying. Holding iron and applying ghee on the head and things like that is not going to help you stop the seizure. Not only that, it will actually delay in taking care of other things like proper positioning and things like that. That may get delayed and it may delay taking the child to the hospital. So when you have active seizures, kindly go through this checklist and make sure that the child is safe. The next doubt is how to prevent a further seizure. There is hardly we can control that completely, but whenever you see a fever, start giving anti-fever medications, antipyretics early enough. Tepid sponging, as mentioned earlier, may be beneficial. You may try it. And in cases where you get recurrent infections, intermittent prophylaxis of diazepam or clobazam may be suggested. It's mainly to decrease parental anxiety. And in very severe cases like multiple seizures with other issues, continuous prophylaxis may be suggested. That is very, very rarely. Phenobarbital in kids less than 1 year and valproate in older children. But basically, what you need to know is all kids who have fever are not prone to have febrile seizures. If you develop febrile seizure, still you don't have to worry. It doesn't affect your baby's intelligence or school performance or behavior, nothing. And the risk of developing a future epilepsy is very minimal. Happy parenting.